Hey everybody, it's George. Welcome back. Hope you're doing great wherever you are in the world. Today I wanted to talk about retirement and living abroad and thinking about this is a viewer subscriber suggestion on a video, and he sent me an email about, hey, you've mentioned some videos about, think about the weather and whatnot, and he basically, his email was, screw that, stop talking about that, worry about healthcare. Here's our situation. I've been hospitalized several times. My wife's been hospitalized several times. That's something that people should be spending more time thinking about. And so I wanted to put this video together, get some comments from you. And as much as I do think weather is an important aspect of where you're going to live, especially, I'll say, the quality of life, I'd rather be in a sunny place than a rainy place. I'd rather be in a warm climate than a cold climate. And thankfully, wife and I are simpatico when it comes to that. We're on the same page there. But talking about healthcare, and it is, for me, from being overseas and living in Portugal, it's something that we didn't spend as much time thinking about. But after being hospitalized there and having some issues and then coming back, it is something that I wish that we spent more time researching. So I hope those of you that are moving abroad or have spent a lot more time than we did. And for those of you that are thinking about moving abroad, hopefully you stick around in this video. Promise I try not to make very long videos, but just think about a handful of things that you might be considering or you haven't thought about that I think you might want to consider when you're thinking about healthcare and moving to another country. So the first thing at the top is, which countries are you going to move to? Investigating their public healthcare options and if they have a private healthcare system. So you're paying into the system, and you have, depending on country, you might want to call it public care, social care, government care. I think depending on where you're from, it may be called different things. Free care, which it's not. What are the options there? What are the wait times? If you're going to move someplace and you're going to have an issue, whether it be a routine, I got a cold, or you have a major issue, are you able to find information on how quickly can you get in for treatment? Or you have, you have a hip replacement. People getting older, hip replacement is a fairly common procedure. If I were getting a hip replaced in this country and the public option, how many months or days or years would it be before I get that service? I think it's very important to think about. And then along that line is, if there are private insurance options in that country that you're looking at investigating, what's the cost? What's the premium increase year over year? Is it pretty flat, or your first year it's pretty affordable, but after that they really gouge you on the premiums? And then what are you getting for that? And researching those hospitals and doctors and services to see, okay, it makes sense to pay for the private option because these are the either expedited services or we get a different level of service. That to me is probably the most critical thing to look at, is trying to determine your country of choice. How does that healthcare treated, public and privately? And that's really the healthcare access of how easy is it to get into the system, so to speak, or to utilize the system, whether it be public or private. Right behind that, and I can speak from our own experience, is language barriers. Are you moving to a country? How much of that language do you know before you move? How much of that language are you willing to learn when you get there for, let's say, integration purposes or not? Also investigating from healthcare services, doctors' offices, healthcare centers, hospitals, systems. How many people, can you do research or get into certain immigrant and expat groups to find out how many places, how many people speak your language? So when you go to the doctor, is there a big language barrier where you're taking the phone and going back and forth with Google Translate of, here's my symptoms, here's your issues, or can you find someone that can speak your language to where you can communicate? Or are you learning enough of the language to where you can understand each other when it comes to medical services? I can speak from having a medical procedure and a short hospital stay in Portugal that it was a hit or miss. Some of the people spoke no English. Thankfully, knowing A2 Portuguese, which is just it's enough to get you citizenship if you want or permanent residency, certainly not enough to be fluent, was able to converse enough to kind of get an understanding, but some of the doctors and the nurses didn't understand English, and so having a conversation, knowing a little bit of Portuguese helped. If I knew more, it obviously would have helped more. But I did, before the procedure, I did look to see if the surgeon that was going to perform the surgery, how many languages, and I think he spoke 8 different languages. So at least in speaking to the main person, I was able to have a dialogue in my language as well as in a little bit of Portuguese as well. But I think it's very important. As you get older, you're going to have stuff going on. And because of that, I think you would be really, really frustrated if you went in to see a doctor and there's no communication, or you have to give the phone back and forth because you can't understand one another, or you need a medical procedure. And I don't mean like a hospital stay. It could just be diagnostics. It's a blood draw. It's a CAT scan, a CT scan or a PET scan. Could be something more major going on too. I think because you'd have a lot of stress built up. You'd either want to know enough of the language to communicate or hope that the people there would know enough of your language to communicate. So I think that people don't give that as much weight as I think they should when going to another country. Now, if you go to a place where you're moving to a new country, but they all speak your language, and forget the last 2 minutes of what I said, because keep moving on, because you know the language. This is one that's interesting, is long-term care options. So let's say you are not able to live full-time on your own, or you need care. You need a nurse, or you need someone coming to see you multiple times a week to take care of things. What does that look like? What are the options in those countries? Do those countries have any options for long-term care? Depending on where you may be investigating, long-term care, and I mean this seriously, means as a grandparent or great-grandparent or a parent, you're moving in with the kids. That's long-term care. There isn't necessarily robust systems built out to take care of people that are aging in, let's say, senior living centers, or some cases the healthcare isn't built out to where they can have nurses and doctors visit where you live or your flat that you're staying in. Those are, I think, serious considerations that you have to work through, because again, your stuff's going to happen. It's going to. I can't count. I would say 80% or more of the few hundred people that we were kind of in contact with in Portugal, 80% of them had to go to the hospital for something. And it wasn't a routine blood draw. They were hospitalized for some issue. Why? Because they were mostly 60 to 80, and they're going to have stuff happen. You know, it happens. So long-term care, one thing as well, I can speak from the U.S. If you have, and I don't know if other countries do this, but if you buy a long-term care insurance policy, not going to cover you outside the U.S. I just spoke to a representative here before I got on this video just to see, hey, what's the coverage here outside the contiguous USA? And they're going, yeah, you don't have any coverage if you're moving to Canada or Mexico or back to Portugal. So that's something to consider, is the first part. If you move to that new country, are there long-term care options if needed? And then also, if you are in a country and you're paying insurance for, let's say, a long-term care option, you're not going to use it. So what do you do with that insurance that you paid into that you're really not going to get out or get anything from? That's another consideration. Lastly, let's say you're in a position where you are not able to live full time on your own in your apartment, your home, wherever you're living. Do you return back to your home country? And is that a consideration? I'll say in two cases. One, because you want to go back because you know the healthcare system in your home country, so you would rather have a surgery, a treatment, or let's say ongoing care there because it's I'll say the devil that you know versus in a new country. Or is it just a situation, it's a practical situation. I can't live on my own anymore. I need help and I'm more familiarized with the systems. So I'm leaving the country I'm living in and I'm going to go back because I know that there are systems or there are agencies in place that will help me and help take care of me while I'm still alive. That's something that, that's a deeper dive than what we went into when we were talking about living abroad. We thought, okay, well, if something happens, we'll go to the hospital and we'll deal with it and we'll move on. I think it is something that many people talk about. I know it's a lot of people, when I've made videos about healthcare and medical, I'll say outcomes in Portugal, people have commented often or they've sent emails asking further questions. So I know healthcare is a biggie and it may be, I don't know if it is the biggest thing, but I think it's right up there. It's 1A, 1B, 1C when people are thinking about a move to another country. And thankfully with technology and with the internet, social media, there's more information out there. Sometimes it's more information you have to weed through, but there is more information that you can think about. But if you've moved, please comment. Let us know what your thoughts were as you're considering healthcare in a new country. Or if you're living in that country, please name the country and what you like or dislike about the healthcare options that are there. And I think it'll help others as they're investigating where to move to know, those of you that have done it, what's good and what's bad about where you're living and the healthcare there. As always, thank you so much for watching. Enjoy your travels.